Uh, I hope the PPT is visible, Sai Prakash. Yeah, so we'll start with boil. So as you can see, this was prepared by one of my student. It's a good PPT, so I'm sharing it with you. So, in a lot of drugs of Matremedica, you must have heard of boil, furuncle. So, what exactly boil is? So, definition that it is an acute staphylococcal infection of hair follicle with perifolliculitis. So, understand the definition that it is actually an infection of hair follicle. So, hair follicle infection is actually called as boil. Most of the times, it is because of staphylococcal infections, and when the hair follicle is infected at that time it will also cause perifolliculitis, means the area around that follicle will also be inflamed. That is why it is called as boil. Now furuncle is another synonym of boil, so don't get confused. Okay, sometimes a question in examination will be asked as furuncle. Now furuncle and boil both are similar and you have to write the same answer. Okay, so who is at risk, means boils किसको होता है, who are the people who might get boils. So boils are most common in teenagers and young adults. So you will see that at your age, you are teenagers and young adults, your age the boils are very very common. That is why you will see that the problem of acne or problem of the small eruptions on back and shoulder is very commonly seen at your age. So it is teenagers and young adults. Second, athletes participating in contact sport or using shared equipments. Now, understand something again. So, if you are in a contact sport like kabaddi, you must have seen that you cannot play kabaddi without contact. So, whenever you are in direct contact, skin to skin contact with any other participant, or you are using shared equipments at the same time, like for example, if it's a football, yeah, or if it's a hockey, there are a lot of equipments which are shared in between while practicing. Okay, so this is one of the reason why athletes also might get this kind of boils recurrently. It is because of direct skin to skin contact, candid contact. Next is individuals with weakened immunity, such as persons with HIV and diabetes, etc. So, if a person has got a weak immunity, the commonest uh, disease or commonest complaint what he gets is recurrent infections of skin, and the commonest infection of skin is boil. Second commonest group of people is the people who are having diabetes mellitus. Now, in my practice, I have diagnosed a lot of cases of diabetes mellitus only on one complaint, that is recurrent boils or recurrent furuncles. So you get a patient around 35 to 40 years of age or more than that, and they complain that, sir, I keep getting boils or furuncles, or I keep getting hair follicle infection either in my beard or in my axilla or in my pubic region or near my anal orifice, and I keep getting it, and I take the treatment and it is healed. So if there is recurrence of such complaints, please check the blood sugar level of the patient. Many times these kind of patients are diabetic. You can diagnose a case of diabetes only on basis of recurrent boils. Next, people who are obese. Now, what happens that whenever a person is obese and he has a lot of fat, at that time, this fat separates your skin from the fascias. There is a lot of fat inside between the skin and the fascia. Whenever the skin is separated from fascia with fat, there are chances that more bacteria may thrive, may live in those areas, and because of which the skin infections are very common in people who are obese. And it depends on which part obesity he is. So I have seen many obese people who get boils on their abdomen where they wear their pants or where they wear their saris, though the pressure, the heat is there. Second thing, a lot of patients get boils on their gluteal regions or their buttocks because of continuous sitting. So according to the percentage of fat, there are a lot of people who might get obese people who might get boils and erection. Next is individual with poor nutrition. Now this happens with some financially poor people like me. uh, the people who are not able to get proper nutrition, especially in India. You will not believe me, there are a lot of people who do not have a proper nutrition. They eat some rubbish things and the nutrition is lost, and because of which also skin infections is very common. And that is why poor nutrition is also one of the major contributors for the boils. Done. Next slide. It is clinical features. So now you have got a patient who probably is diabetic, and how to understand whether this person has got boils or furuncles or it is something else. So first complaint is it starts with painful and indurated swelling which gradually extends. To understand something, last time we have learned about abscess. Now abscess also is very similar to that of boil, but abscess may happen at anywhere, means there is no need of hair follicle or something. Very similar to that, the symptoms are very similar to that, but it is always related with hair follicle. So it starts with painful and indurated swelling. as simple as your acne, a pimple. पहले क्या होता है, सबसे फर्स्ट क्या होता है कि there is a small swelling which is indurated, means hard to touch. The consistency of that swelling is different. Okay, and it is very painful, so you cannot touch it. It is also tender. It is tender to touch, right? So uh, initially you will get a reddish, painful and indurated swelling which gradually extends, means the area increases slowly. The area increases. The boil is not very big. The boil is always a smaller structure, less than 3 centimeters, but it increases in size. It increases in size slowly. It increases in size by involving the surrounding cells and tissues. Second symptom, like I said, it has a tremendous tenderness and surrounding edema. So the pain is a lot, and it has a tenderness, means you cannot touch that swelling. You cannot move the part where the swelling is. Okay, and the surrounding area of that furuncle of that boil will have some edema. This is because of a basic pathology of inflammation where tenderness is there and surrounded area is edematous. After some days, there will be softening at the center and a small pustule appears. After a few days, a day, 2 or 2 days or 3 days, what happens is there is a small, at the center, there will be necrosis, and because of which there will be a small pustule which appears through the hair. तो जहाँ पे आपका hair जहाँ से निकल रहा है उसी area में आपको क्या हो जाएगा, a small pus at the center, which is also called as a pustule. So a small pustule मतलब क्या है? Any small swelling which has a pus is called as pustule. So a boil will have a small pustule at the center after a few days. Okay. Next slide. Next clinical feature. It burst spontaneously, discharging greenish small amount of slough. What happens that when this hair follicle infection grows, the hair becomes very loose. So क्या हुआ है, पहले तो आपको you got a swelling, then there was a tenderness and pain was there. After a few days, there was central necrosis and there was a pustule at the center through which the hair is coming out. Slowly, what happens that the hair follicle becomes very loose and the hair comes out. When the hair comes out, it creates an opening for that pus, and a small amount of greenish yellowish pus comes out spontaneously. All the hair follicle infections do not require any procedure unless and until those are not opening spontaneously. वो अपने आप खुल जाता है. It opens automatically, and a small amount of greenish pus in the form of a slough. The pus is not thin; it is thick like a slough. It comes out. After this, a deep cavity develops lined by the granulation tissue. So if you then observe the boil, what exactly has happened after removing all the slough and pus, you can see that there is a deep cavity which is surrounded by granulation tissue. This is the only course of any kind of boil. So initially you will get an hair follicle infection because of all the reasons what I told. Followed by that, there will be pain and inflammation surrounding that hair follicle, which is also called as perifolliculitis. There will be tremendous edema and there will be tremendous tenderness, and surrounding edema will be there. Slowly what happens that a central part becomes yellowish green, and there a pustule will appear. It bursts spontaneously, discharging greenish yellowish small amount of slough. When it is removed, if you can see that there is a deep cavity which is developed and which is lined by granulation tissue. This is how any kind of boil will appear in anybody's body. Okay, next slide. What are the commonest sites of boils? So automatically, the because it's a hair follicle infection, because of that, it is always common in the parts where there is abundant amount of hair. So first boils are common on back and neck. So back and neck, this is exactly where you can see a lot of people I have seen have small boils on their hairline on the neck. Second is back, because almost all male, female, most of the people have a lot of small hair on back. So it is commonly, and back has always it is a part of body where pressure is put when you sleep or when you sit on a chair. This is also common. Second, boils in the external auditory meatus. Now, this also is very common. आपका जो कान है, auditory meatus, around that, because there are small hair in your ear pinna, and there also boils are very common. Infections of perianal hair follicle is also called as perianal boil, which when ruptures results in perianal sinus or fistula. Now I was talking that the boils are also common around the anal orifice, which is also called as perianal region. So whenever there is perianal hair infection is there, it is called as perianal boil. Now, this one area around the anus is very dangerous. Why? Because if the boil is not treated properly, the boil will go deeper. The boil will go deeper and it will create a sinus or a fistula. Now, first of all, I would like to tell what is sinus. Now, sinus is a blind track. Blind track means it is open from one side and another side it is closed. So it's a track. It's like a tunnel, but which is closed from one side. It is called a sinus. So sinus is an inflammatory blind track. Okay. So the boil results in a track which is blind at one side and it is filled with pus, which is called as perianal sinus. And when the boil creates a track between two hollow organs or a hollow organ and skin, like rectum or anal canal and skin, where there is a tract which is open from both the sides, it is called as a fistula. Okay, so this is the difference between sinus and fistula. So sinus is an inflammatory blind tract, whereas fistula is an inflammatory tract which connects two hollow organs or one hollow organ and skin. Am I clear? I will take probably one class for sinus and fistula also, but it's not much to study. Sinus is a blind tract, and fistula is open from both the sides. Okay, so these perianal boils may result or may complicate into perianal sinus or perianal fistula. So we'll go to next slide. Yeah, can you see these boils on the back? ये थोड़ा exaggerated है, but I have seen people who are getting boils like that. Okay, and you can see the another picture where the boil is in the auditory meatus. This is also very common. Auditory meatus boil, this is also very common. Next slide. Yeah, this is a commonest furuncle which or boil which I have seen at the hair margin और hair जहाँ पे आपका बाल खत्म होता है neck पे hair margin, there you get a lot of furuncles. Another site is scalp, because scalp has abundant amount of hair, so scalp पे भी बहुत बार boil होता है. It's the commonest site for boils or furuncles. You can see this picture, it's a very nice picture. If I can zoom it, you can see that what has happened. You can see that it's a localized inflammation and edema. The central part is yellowish, and probably there was a hair which is now plucked out. And if he tries to remove it by pressing, the yellowish green slough will come out. Okay, we will go to next slide. So what are the complications? Next slide. What are the complications of boils? So boils may lead to cellulitis, particularly in those whose power of immunity is less. So the next topic I'm going to take is cellulitis. So I will not go details about it, but the boil, or in that case any infection of skin, will result into cellulitis. Okay, especially ये किसमें होता है, either in immunity less people, or second is especially diabetes mellitus, the people with diabetes mellitus. The boil may also lead to infection of neighboring hair follicle, where number of hair follicles are too many, leading to hydradenitis. Now this is something interesting, that what happens that one, if the person has got hair follicle infection in an area where there are abundant amount of hair, one is scalp, another is axilla, another is perianal regions. So यहाँ पे क्या होता है that if one hair follicle is infected, the infection is going to be spreaded to some other follicles also. This will cause to a condition which is called as hydradenitis, which means that a lot of hair follicle together will create a large uh, boil, which is also called as a carbuncle. We will teach carbuncle some other time, but this is how it might cause the complication, that multiple hair follicle may get infected together at same time. Last complication is boils usually secondarily infect the regional lymph nodes. Now this becomes a problem. Now understand the mechanism of the lymphatics. ये एक ऐसा सिस्टम है जो हम फिजियोलॉजी सीखते वक्त बहुत कम उसको इम्पोर्टेंस देते हैं, बट विच इज अ वेरी इंपॉर्टेंट सिस्टम ऑफ योर बॉडी, विच इज lymphatics. Okay, so whenever you get any inflammation after an injury or after an infection, whenever you get any kind of infection, it could be bacterial, it could be viral, it could be fungal, it could be parasitic, any infection. In all these cases, the first line of defense is always lymphatics, lymph nodes, lymphatics, so lymph system. Okay, so whenever you get this kind of inflammations or infections, the lymphocytes come into the role, which are actually channelized by the lymph nodes and the lymphatics. That is why अगर आपने देखा रहेगा, if you get an injury to your hand or on your arm or forearm, you get lymphadenitis in your axilla. If you are getting any infection or inflammation on your legs or your thighs, you get a lymph node inflammation in your groin region. If you are getting any infection or inflammation of your teeth or of your scalp, you get inflammation of lymph nodes of cervical region in the neck. So whenever boils appear, they automatically secondarily infect the regional lymph nodes according to in which region the boils are. And these lymph nodes slowly, when got get infected, these will turn into abscesses very quickly, and it will be a big complication. Okay, so these are the complications of boil. So if a person is healthy, means he is not having HIV, he is not having diabetes, he is not having anemia, and his immunity is good. If he gets a small boil, it it gives pain for a day or two. It gets yellowish at the center, and the pus is removed, and in within 3 to 4 days, the boil is gone without any scar also. But if the patient has already compromised with the immunity, has a higher level of blood sugar level, then these boils may cause some complications which are very difficult to treat. Okay, so this is about complications of boil. Now, what treatment to be given? Conservative, surgical. I hope आप अपने अपने घर में बोल रहे हो conservative, surgical. Now, conservative treatment, what to be done? First, general health of the patient has to be improved. Like I said, if a patient is healthy, the boil may appear and it will get cured without any complications. So, general health of the patient has to be improved. Means what? The maintenance of good hygiene. The hygiene should be maintained. Normally, one should not use equipments of other people who which are close to the skins. मतलब एक दूसरे के कपड़े नहीं पहनना है. If you are using some towels, the towel should be separate. अब मैंने कई बार देखा है लड़कों के रूम में, लड़कियों के रूम में भी एक ही टॉवल दो तीन लोग यूज करते हैं, जाने दे क्या होता है. ज्यादा कुछ होता नहीं, बट दिस काइंड ऑफ इन्फेक्शंस कैन बी स्प्रेडेड. So care should be carefully handled in diabetic patients. So patient is diabetic, the first thing is to check the blood sugar level of the patient. and try to bring the blood sugar level to the normal level. If the boils are recurrent, diabetes should be excluded. Like I said, many of the diabetic people are getting diagnosed only because of their recurrent boils. Athletes, participants in contact sport should not use or share their equipments. Like I said, they should not share their clothes, towels, and all this. This is about conservative treatment. But if the boil is too big, it is too painful, and there is recurrence, then the incision is usually unnecessary as the pustule is very small. Only touch of iodine on the skin pustule will hasten the necrosis over the overlying skin and it helps to drain it out. मतलब क्या है कि इसको ड्रेन करने का जरूरत नहीं रहता है. Not no need of draining it. Just touch of iodine should be given on that area. So आपके पास betadine का वगैरह अगर solution रहेगा, that has to be applied on that pustule and keep it closed. Yeah, that will slowly automatically will fasten the necrosis and the overlying skin is removed and the pus will get out, so it doesn't require incision. After the escape of pus, the part should be cleaned twice with suitable disinfectant. So once the pus is out, then that the cavity which is being created up by the boil should be cleaned with suitable disinfectant. It could be betadine, it could be Dettol, Savlon, or whatever you are using. That cavity has to be cleaned and it should be dressed properly so that it will heal faster. Okay, this is surgical treatment. I will not go into therapeutics because we will see that some other time. Okay, so now I am stopping my sharing of screen, and this is all about boil and furuncle. Yeah. So, till now, any questions till now? Any questions? No? If no question, then I would like to go to my next topic, which is also a very small topic and which is related to boils, that is cellulitis. Shall I proceed? Please text in the chat. Shall I proceed? Blind boil ऐसा कुछ नहीं रहता है. Boil is boil. I am saying blind tract sinus. So when the blind boil can be called like if the boil is not opening, the hair follicle is inflamed and the hair is already plucked out and still the boil is not coming out, then it can be called as blind boil. Now there is no actually surgical terminology called as a blind boil, but blind boil can be called when there is no opening to the boil, and at that time we have to create an opening. Like I said, it need not to be drained. It need not to be drained. Just apply some iodine tincture on it, and the boil will open up. Yeah. Any other question? Yeah. Any other question? Yeah. So I think I'll proceed to cellulitis. If there are any questions, you can write those down, and we'll see those later. Okay. Okay. Sharing my screen again. Cellulitis. Again, this is also prepared by Jagdish. Take some time. Yeah. Is it visible? Cellulitis? Is it visible? Yeah. We'll start with cellulitis. So first of all, definition. What is cellulitis? Uh, it is a non-suppurative inflammation spreading along the subcutaneous tissues and connective tissue planes and across intracellular spaces. Now, this is also an inflammation. Yeah, cellulitis is inflammation of cells and tissues. Very simple. But how is this inflammation? This is non-suppurative. So there will be no pus. There will be no pus. You have seen that the both inflammation what we have learned, abscess and boil, those were suppurative. So automatically after a few days, the lesion will turn into suppuration, pus will be created. But in cellulitis, there will be no pus. So it is a non-suppurative inflammation spreading along. क्या है? This is a spreading inflammation. So it spreads along the subcutaneous tissues. I hope you understand what is subcutaneous. So under the skin, there are some tissues, a layer of tissues and the connective tissues, which are called as subcutaneous tissues. So it spreads in a plane of connective tissue and across the intracellular spaces. So there are spaces in between the cells, which is called as intracellular space. So this inflammation spreads along these three planes. One is subcutaneous tissues, connective tissue planes, and across the intracellular spaces. So this is not going deeper. This doesn't go into the muscular layer, or this doesn't go into some other organs. So this is going to remain along the subcutaneous tissue only. This is called as cellulitis. So again, this is a skin lesion. Like a boil also was related to the skin. This is also related to the skin only. Okay. Next slide. Yeah. Can you see this? I will just zoom it. Can you see this picture? The leg. See, the boil is there, a small boil, and the reddish lesion around that boil is called as cellulitis. You can see that the reddish thing is inflammation, and it is slowly spreading along. Okay, even in this picture, you can see it's some injury and or some infection, and because of that, the reddishness is into the wrist also. So this is a spreading inflammation along the subcutaneous tissue. This is called as cellulitis. Okay, next slide. Yeah, this is a great picture. Can you see the cellulitis of leg? Now, this is a typical kind of cellulitis which we see in diabetic people. Okay, uh, the in this picture, the cellulitis has started somewhere in the foot, and slowly it goes on increasing towards the knee joint. कैसा है देखो, it is reddish. There is some edema. The skin becomes hard and thick, and slowly the inflammation goes spreading upwards. It doesn't stop. Actually, it doesn't stop unless and until the blood supply or the skin texture is changed. Okay, so this is a classical example of cellulitis of a leg. This is a cellulitis of the hand. Probably there is some infection or inflammation of somewhere in the fingers or in the nail bed, and the cellulitis has spread to the whole of the uh, hand. Okay, so this is cellulitis. What are the causes? Next slide. What are the causes? The causative organism is mostly the Streptococcus pyogenes. Now, you have seen that in boils and abscesses, the commonest bacteria seen is Staphylococcus. But many times in cellulitis, the commonest bacteria which causes cellulitis is Streptococcus pyogenes. Variety of aerobic and anaerobic bacteria may produce cellulitis. So it's not one bacteria only, but variety of aerobic and anaerobic bacteria may also produce cellulitis. Next slide. What is a pathology? The organism usually gains access through a wound or a scratch or following the surgical incision. This is very similar to all the things. Organism has to gain entry into the body. Now it gains the entry into the body through a wound. Now wound can be, it can be a mechanical wound, it can be a boil like we said, it can be a pustule, it can be a furuncle, anything, or a scratch. So we have seen a lot of time the people with diabetes or varicose veins, they get itching of their legs and they scratch it very badly, and when they scratch they open their skin by their nails, and then the organisms may gain entry into the skin or following some surgical incision. That is why cellulitis is the commonest complication after many of the surgical procedures. There is a widespread swelling and redness at the area of inflammation, but without definite localization. Now, abscess and boil were a localized pathology where the pathology is limited to some part. Okay, आप then boil up कभी more than 3-4 centimeters boil you will not see. An abscess will be only limited to the uh, sac or in a cavity where the pus is collected. But cellulitis may spread very widely and there is no definite localization. Okay, initially the site of inoculation becomes red. Inoculation means from where the bacteria have entered, that part becomes red initially, and slowly the skin swells and becomes shiny. Cellulitis का हमेशा एक clinical feature है, always the cellulitis skin is very shiny. Red and shiny skin with pain to touch, tenderness is a classical characteristic feature of any cellulitis. Okay, we'll go to the next slide. In severe infections, blebs and bullae form on the skin. If the infection is very bad, then this inflammation may turn into blebs and bullae. Blebs means it's like small bubble-like swellings. Bullae is also similar, bubble-like swelling on the skin. Now, even though it looks like a swelling, it is not a swelling. It is just a layer of skin is elevated with some watery or purulent discharge inside it. This is called as blebs. This will happen in very severe cases. Normally, cellulitis doesn't have this, but in very severe cases, you might see that. Central necrosis may occur at the later stages. जैसे जैसे धीरे धीरे the cellulitis increases in size, and if the infection is not under control, then the whole cellulitis becomes a complete abscess-like structure, and there will be some central necrosis and putrefaction in the later stages. But it's very uncommon. लेकिन हो सकता है. Hmm? We'll go to the next slide. What are the clinical features? First, there is very fine degree of fever and toxemia. Cellulitis will start with infection and inflammation, which will cause fever and toxemia. The affected part is swollen and painful. Like I said, I have shown you pictures. The affected part is swollen and it is increasing every day. The area is increasing. The swelling area of swelling is increasing every day, and it's very painful. Diabetic individuals suffer from cellulitis very often because uncontrolled infections. On examination, if you see the part of cellulitis, the affected part is warm, swollen, and tender. If you touch, agar though if the two legs are, the patient has two legs, one leg is involved, you touch the normal leg first, feel the temperature, and then feel the temperature of the affected part. That part is warm, it is swollen and tender. Patient will say that please don't touch, doctor, it is very painful. There is pitting edema and brownie induration. What is pitting edema? So if any part is indurated, if any part is swollen, you have to press with your index finger. If there is a pit, वहां पे अगर खड्डा हो जाता है, a pit which is in that area and which is slowly again filling back, it is called as pitting edema. Okay, and brownie induration, brownish color and indurated part is there. The surrounding lymph vessels may be seen as red streaks due to lymphangitis. The cellulitis will definitely cause lymphangitis also. The regional lymph nodes will be enlarged and tender with acute lymphadenitis. Like I said, lymph nodes and lymphatics are the first things to fight against these infections. So in all cellulitis, there will be lymphangitis and lymphadenitis also. Okay, next slide. So what treatment to be given? Okay, normally cellulitis is a secondary pathology after some injury, after some wound, after some surgery. That is why it is to be treated in a different way. So treatment again conservative surgical, rest and elevation of the part to reduce the edema. So rest is very important. If the patient has cellulitis of leg and he is still walking and roaming around, then definitely it is going to increase. Okay, so the patient should be rested. Elevation of part is important so that the edema will come down, but it is a temporary thing. Appropriate antibiotics, preferably broad spectrum, should be administered. So if you are practicing allopathy, a broad spectrum antibiotic should be given so that the infection will come under control very fast. Failure of inflammatory swelling to subside after 48 to 72 hours suggests that abscess has developed, and in that case, incision and drainage of the pus should be accomplished. So, if the cellulitis after prescribing antibiotics is not subsiding within 2 to 3 days, it means that that part has gone into developing an abscess. So, the whole cellulitis part under the skin, there is a abundant amount of pus which has to be removed by incision and drainage, what we have seen in the treatment of abscess. Okay, so pus should be removed. Okay, so this is the treatment of cellulitis. Normally all the cellulitis can be treated, I will say 90% of the cellulitis can be treated with proper administration of antibiotics if you are practicing allopathy. In homeopathy also we have definitely a lot of good drugs, but once the pus has settled, the only way to treat cellulitis which has turned into an abscess is to remove that pus. Do not treat to absorb. Okay, we have to treat to remove that pus. But till then, in 90% of cases, these homeopathic remedies also will definitely help. Okay, so that is all about cellulitis. So I'm stopping my share screen. Yeah. So any question till now? Any questions? We have learned two basic topics today. One is boil, another is cellulitis. So sometimes boil may cause cellulitis. That is why I have selected those topics. So boil, if not treated properly, will turn into cellulitis. If not treated properly, then those will turn into abscess, which we have already learned. So till now, any questions? Please, chat box open है. आप directly भी मेरे से बोल सकते हो. Not an issue. Any question? No questions is good thing. Anyways, I have to go to college. Okay, then if any questions are there, then just let me know. Now again, I have received around 60 something, 60 odd assignments out of 85. That's a good number, and I'm going to reply and give marks to all the assignments whenever I get time. But now there is second assignment which is I'm going to create, which is a very small assignment again, which will have like 10 to which you will require like maximum of half an hour. So I will think about the assignment and I will post it on the attachment by today evening, today night, and you will have a lot of time for that. Till Sunday night also you can submit. Okay. So thanks a lot. Yeah, I'm ending my today's lecture. Thank you.